Today's a tough conversation. It's a conversation that needs to happen. And I can't promise we have any answers today, but we do want to tackle racial disparity in the health system itself. And here today to help me have that delicate conversation is Dr. Serena H. Chen, as always, with Monday Motivation. And Serena, this is something, thank you so much, first of all, for being willing to have this be the focus of our dialogue. You know, our team today woke up and had a conversation about implicit bias, and it shows up in the health system a lot. You know, and I think I'd like to start by asking, what has your experience been being an Asian woman in coming up through the health system? Have you yourself, you know, faced any implicit bias even against Asians or against being a woman? You know, have there been biases against you as you came up through, you know, your career?
There definitely have been. I mean, you know, when I was little, like in the 70s, I grew up in suburban Philadelphia, and you know, there weren't really other Asian kids around, and so that was hard. Anytime you're different, that's hard, and definitely being a female in medicine. When I went to medical school, I was definitely being an Asian female in a very small minority. And both patients and other physicians, you know, it's hard to get yourself accepted as a physician. So I would always wear a white coat. I would always have my name tag present, very easy to read with my title on it. And you know, I'm very petite, so I always had heels on. You know, there's definitely, you have to present yourself in a certain way in order to be heard or to be taken seriously. I think what we're seeing right now with COVID-19 is uncovering something we've faced a lot in women's health, and that we've struggled with a lot in women's health, is that, first of all, women's health, reproductive health, gets a lot less funding and research and attention than diseases that affect men primarily. And that's always been something to wrestle with. And we are dealing with a maternal mortality crisis. Like, our country has for many, many years been behind other developed nations in terms of keeping moms and babies safe. And the moms and babies that are at the most risk of dying in this country are the Black and brown moms and babies. That there is no denying that. That's true in almost every state in the union. It's a huge issue. And we have
I think what you just said is really important. You said in every state in the nation.
Yeah.
And how, you know, so how do we continue to let that happen here in the United States, this wealthy nation with great medical care? And, you know, it makes it hard for me to breathe.
You know, Alice, I'm not sure I have all the answers, but I do feel like there's, you know, we are not meeting patients where they are. We don't have a healthcare system that people trust. And if you don't connect with your patients and you don't communicate with them, and they don't trust you, you cannot inform and educate them. And if they're not informed and educated, then you do have to higher death rates. You do. I was very, you know, I trained at Johns Hopkins in inner city Baltimore. And when I was a resident, I was told, you know, you have to really pay attention to your patients in clinic, because they remember when Johns Hopkins used to experiment on them. And there's like, you know, it's decades ago, but there's still that cultural history. There's still that mistrust. And that creates a barrier to care.
Right.
Because how, you know, if if the patient is always second guessing the doctor, then you have problems with compliance and raised levels of anxieties. You do get poor outcomes.
Or they don't even, I mean, they oftentimes don't even maybe want to go in, right? In the first place.
And
they don't even, yeah.
Brings up, I was at a meeting in Newark with Ross Baraka, the mayor, and a lot of people from our healthcare system. This was during Obama's administration. It was like a White House initiative to try to say, how can we do better with healthcare in our inner cities? And I remember, this is at Newark Beth Israel, them talking about, what is going on. We have this gorgeous multi-million-dollar breast cancer care facility, mammograms, breast cancer care. This is a phenomenal, gorgeous center. Why are so many women in Newark dying of stage 3 and stage 4 breast cancer on our doorsteps when we can prevent breast cancer today? And I told them, I said, well, number one, your website is it doesn't engender trust. It looks like a banking website. There are no people that look like your patients on this website. The demographic of your website is very biased, and it's also very male. And and why would a Black woman go to a place that looks like it's controlled by a bunch of white male bankers and take off her shirt and stick her breast in a vise? And why would she do that?
Why would she do that? Exactly.
How could she trust you? You have to trust somebody to take off your shirt and stick your breast in a metal vise. You have to trust the person that's ordering that test and that's doing that test for you. And that's, we can save lives, but we cannot save lives if we do not speak the patient's language, if we don't talk to them with empathy and compassion and without judgment. And this is what gets me all worked up when doctors say, well, I'm not on social media. That's beneath me. That's not a valid method of communication. Well, your patients are on social media.
Exactly.
Dr. Google is in the United States. Dr. Google is the first doctor the vast majority of patients will seek care from.
That's right.
And
if they're not, and we've said it over,
Alice,
that's right. We've said it over and over that the most widely shared articles receive the lowest scientific accuracy rating with all the scientific watchdogs.
Because they're the most accessible.
Yes.
So if you're wearing your white coat and you're in your ivory tower and you only leave your phone lines on and people cannot reach you by text, by email, social media, they can only call on the phone and drive to your office. And by the way, you're closed for lunch hours and you don't pick up the phone and you don't speak the patient's language. Those are all barriers to care, and they have a huge negative impact upon outcome.
Well, I think you just touch on something else that makes made me think of this, which is geography can be such a barrier to access, and geographically, based on where you are, could actually be part of contributing factor to these racial disparities. And if in fact, in downtown LA, I know somebody who has a dental charity. And so he works with USC's School of Dentistry, and they go and bring basically dental care to at-risk youth and, to homes where if kids need dental care, they can't get there because their parents can't take time off of work to even get them dental care because of what you're saying. If you don't have anybody working in the evening or on the weekends for people who quite literally, and it's not, this isn't part of a racial thing. This is absolutely more just economic disparity. And, sometimes they're, concentric, right? That there's both a racial disparity and an economic one. And in this case, it was sort of breaking my heart where I was thinking, your kids could just be in so much pain. But if it's the difference between, you earning your paycheck that day and being able to feed your whole entire family the next day, versus getting the kids in, for the dental work. And it's not, no shame in those parents. They're grinding, they're doing the best that they can. And I love how you put it, which is, if in the health system we don't meet them where they are, then there's going to constantly be these huge gaps.
And this is why I hope everybody who's listening to this will support the continuation of telehealth for the future. We implemented it for the pandemic, but honestly, the technology is there to make healthcare much more accessible in many different circumstances for all patients for very relatively low cost. It's better for the providers too. It's better for the providers and for the patients. Absolutely. And I think that could make a huge difference. Obviously, it's not going to solve all these issues, but I do feel like there's so many people who there's so many incredible barriers to accessing the healthcare system, insurance, and getting to the doctor's office, just finding somebody that you can connect with and that you can trust. It's very, very difficult, and I don't think we as a healthcare establishment make things very easy for the patients. It's very difficult.
We also have a health system that's filled with workers who have implicit bias. And, our conversation this morning, it was with our team, was about, kind of recognizing what that looks like in your life. Does that mean that, and it's noticing where it shows up for you. If you notice a headline that uses a race to describe someone who is accused of a crime versus a headline that does not use race to describe a person who is accused of committing a crime. If you see that it's somebody didn't have race attached to that headline, 99.9% of the time it's a white person. 99. I mean, we could just go back through all, so much journalism, right?
There's a lot of statistics about that. Exactly.
Yeah. And so, it's moments like that if we start noticing, then we can start changing implicit bias within the health system ourselves. How are we showing up as patients in the health system with implicit bias? How are we healthcare providers, where we can break down implicit bias? Do we, we talked this morning about, are you the person who crosses the street when you see a young African-American male with a hoodie up? That's implicit bias. Mm-hmm. If you do that. And it isn't about shaming implicit bias, but it's about noticing it, because that is the key, is that it's implicit, it's inherent. It's so rooted in the fabric of your being that if you don't bring mindfulness to it, if you don't bring awareness to it, then we can't dismantle it. And then it just perpetuates. We do see this. We see the outcome of this in the health system and its poor outcomes. It is heartbreaking outcomes. People die. It's not just dying at the hands of police brutality. People are dying in our health system, in droves who have a different color of skin than I do, and that's not right. And our team discussed what is there for us to do, what is there as actions for us to do, and it's to notice when something's not right and to say it's not right. It's not okay. It is not okay that African-American women die of breast cancer more, that I didn't die of breast cancer. My African-American peers die of breast cancer more. My African-American peers are, if they're dying of just having a baby, I can't even, it's been a really emotional day. Yeah. I think that we have to have these difficult conversations. And like I said to my team this morning, Serena, I don't have any answers. I don't have all the answers. I have, but I do feel like we have to talk about it, and that we can't talk about it only in the context of our personal lives. We have to talk about it in the context of our professional lives. And we work in the healthcare system, right? We're part of it. We're part of advocating inside it. We're part of supporting it. You're part of being a provider in it. And I just wanted us to open the dialogue today and put this out there, to start getting more conversation about it. I hope people across all the platforms that we share this will start commenting, so that we can get like a good dialogue going about where they see race show up in their own access of healthcare, where they feel like they themselves have a barrier. And let's start trying to dismantle that one by one.
It might be interesting. I don't know if we can use the app to like do surveys and things like that. That
We
might be an
can.
interesting thing to do.
Yeah, we can.
To take a look at those things.
Absolutely.
I
I'm also very proud of the fact that the app is very well represented across all ethnicities. And it's something that I have, that was so intentional by all of us from day one, is that everybody can find themselves regardless of race, sexual orientation, marital status, however they're showing up to us, that they feel safe. It's one of the reasons I've been so adamant about patients being anonymous,
yeah.
so that there's an
And
extra safety layer.
Not just safe, it's easily accessible, right from your phone.
Right.
And that's, I think, and we try to put a lot of good information out there and try to get people answers. And, hopefully that's breaking down some barriers. I do feel like information, the ability to get good information from people who have the background and the training, as opposed to just from Dr. Google, will make a huge difference in healthcare.
Agreed.
Absolutely.
Agreed. Well, we'll just keep the dialogue going. Thank you for having it. Like I said, when we started, it's a bit delicate. I myself, as a privileged white woman, don't necessarily even know how to have the conversation, but I just felt like we need to open our mouths and start the dialogue. So I appreciate you diving in there with me today. And, that's kind of our takeaway from Monday Motivation, is just jump into the conversation with us, and let's improve things.
And maybe we'll be sending you a survey soon about stuff like this.
Exactly.
Yeah,
exactly.
That would be cool.
That would be cool.
I'd love to hear from all our users.
It would be wonderful. Yeah. All right. As always, thanks, Serena, so much. Have a great week, everybody. We hope that you're safe and healthy.
Stay safe. Yes.
Stay safe.
Care.